who has joined today for this exciting webinar with our esteemed guests. Um, we are going to start with a quick introduction to our guests, and then um, we will get going with the webinar topic itself. Um, uh, I know that there are a few more people joining, but let's get started with. So as you all know, we are going to talk today about preventative technology and its role in preventative healthcare. And we are joined with three speakers today. We have Patrick Dunn. Pat Dunn is a program director at the Center for Health Technology and Innovation at the American Heart Association, and we'll get to know a little bit more about his work there, as well as AHA's contributions to this important field. We also have Anil Joshi, who is the founder and CEO of IntelliHedge, a company which is also focusing on several aspects of bringing healthcare to people's homes. And of course, we have Sri Reddy, who is the founder and CEO of the REN Foundation, also working on making technology tools available for people to manage their own healthcare at their homes. Welcome, Pat. Welcome, welcome, Sri. So the webinar, as I mentioned, is about the role of technology in preventative healthcare. We are all hearing a lot about technology, healthcare innovation, digital health in its various avatars. And so we really wanted to get behind the scenes and really understand what is happening in this field, and especially focus on the preventative medicine side to understand how healthcare technology is being used to prevent and reduce incidence of diseases, to identify emergence of new risk factors and manage them upfront. Also increase, potential survival rates, and in fact halt disease progression if at all that is possible. So those are the various range of topics that we will try to cover today. During the session, if you have any questions, please feel free to add them into the chat box, and we'll try to take them throughout the session. We really want this to be a discussion rather than just a one-way dialogue. So let's begin with our first set of questions, and I'm going to start with Pat. What is this preventative medicine, and why are we hearing about it all of a sudden more and more these days?
Yeah, thanks, Santosh. So preventive medicine can be, as opposed to treatment, diagnostics, preventive medicine is really designed to engage in behaviors. And so what we're trying to do is promote good behaviors, and we're trying to manage or eliminate bad behavior. So a good behavior might be taking your medications that your doctor's prescribed. A bad behavior might be tobacco use or eating too much. So that's really the core of preventive medicine. Now, why are we hearing about it so much? Well, honestly, the pandemic, COVID, has taught us all a lot about public health and epidemiology and the need for both treating conditions, whether it's an acute condition, a chronic condition, or an infectious disease, but also how do we prevent it? So, things like vaccinations, wearing masks, all of those things really are in the prevention category. An antiviral might be in the treatment category, and a COVID test, for example, might be in a diagnostic category. So prevention is just its own space within that.
That's excellent. And so really, this is not a new topic as such. It's just getting a little bit more attention because of...
We've been trying to prevent things throughout the ages. Sometimes the topic changes, but the reality is, we prevent, from being harmed, basically. We can be harmed by physical violence, by germs, or by things that break down inside our bodies.
That's excellent, and that gives a very good basic background about why we are talking about it. It's really not something that's fallen out of the sky kind of thing. Anil, how about you? What do you think about this aspect and your perspective about it?
Yeah, sure, Santosh. So I come from the public health background. So prevention is very close to my heart. And I think the way I think about prevention is more like, how do you prevent diseases and promote health? And there is a very, very old saying, as Pat was saying. I think an ounce of prevention is much better than a pound of cure. So as a public health and population health perspective, that's what we are trying to achieve through, making people aware of what would be a good behavior to prevent diseases and what could actually promote health. The other aspect that I see in contrast to the treatment versus prevention is that in medical schools, we are trained to provide care for patients one at a time. Public health measures are directed towards the populations. So what can we do that has a large impact on the population? And it boils down to what are those behavioral changes that we can bring in our lives that can actually help people on a large scale. So that's sort of like how I see the preventative medicine. In terms of why this is getting more attention, there are several reasons, I think. One is because of this internet, YouTube phenomenon, there are all kinds of experts are now coming along and talking about different kinds of things people could do. There could be 10,000 videos on how to get your six-pack abs, right? There may be, hundreds of videos in terms of how somebody became, cessation of the tobacco smoking. So this whole idea of the prevention just sort of like had spread, like a wildfire because of this awareness, and so much information is available. If you look at magazines in the December and January month, everybody's talking about health behavior, prevention, all kinds of stuff. So in general, there is a much larger wave of this idea. Second, I think, is driven by the medical profession as well. We all know CMS is looking for value-based care. Value-based care means you have to improve the outcomes for the patients and less hospitalizations and less ER visits. So how you can prevent that to happen? So there is a element of prevention and early intervention, which is in the realm of prevention. So I think those two factors certainly are helping, in my view.
I think those are fascinating opening thoughts as well from you and me. And we'll definitely talk about this balance between the personalized, individualized side of the preventative care, as well as the whole public health, population health angle to that. Thanks a lot for those. Um, and then let's also talk about technology and why there is so much talk about technology and its role in preventative health. Just as opening remarks, Pat, would you like to come in and talk about that? Why we are talking about technology?
Sure. Well, healthcare has always been rooted in technology and innovation, whether it's, laboratory testing, medications, diagnostic testing. So, I mean, from developing an electrocardiogram to discovering a new vaccine to discovering new imaging technology. So we've always had technology and innovation. What's changed a little bit, as Anil mentioned, with the internet and the ability to reach more people and to reach people outside of the healthcare setting, that's where the technology that we're focused on really has a lot of promise. It's really designed to promote, using a public health approach, promote positive behavior, but it is only a tool. And it's only a tool that works if people actually do it. It's not a one size fits all. There's a lot of different ways to promote that behavior. One thing that's very exciting to us is technology has the ability to improve access. there are a lot of people in the US and around the world that just don't have access to the same type of healthcare services the people who may live in the cities do. So you can improve access. You can do simple things like reminders. It can just simply be, hey, don't forget to take your medication. There are ways to track data. That's also very, very encouraging. So whether it's your physical activity with a physical activity tracker, whether it's tracking blood pressure with a connected device. So again, there's a way to not just rely on, say, the blood pressure that was taken in the doctor's office, once a year, or to have to rely on the individual's memory. You can actually track things in real time. And the idea then is to be able to get that feedback back to their healthcare professional. Another very important aspect of prevention is education. Sometimes we minimize the role of education, but it really is the roots. It's the knowledge. If you don't have the knowledge, if you don't understand, then you're not going to be able to do any of the other things. So it's a way to educate. And again, there's different types of technologies, whether it's listening to a webinar like this, collecting a message on your smartphone. There's different ways to do it, even a message that's coming from your watch or your activity tracker. And then finally, it's a way to connect with people, again, outside of that local community. It's a way for healthcare professionals to connect, and it's even a way for other patients to connect. There's a lot of relatively rare conditions, and so you might not have very many people with the same type of condition in your local community. You can connect. I know there are challenges of social media, but the reality is, if done well, that connected piece of it is a huge part of helping people change and maintain those behaviors.
Those are all fascinating angles. So I'm going to ask Sri at this point of time. Sri, you have spent a long time in leading various technological innovations in other fields, and now you are in healthcare. And how do you see this change happening in healthcare, and especially focusing on the preventative side?
Yeah, Santosh. Yeah. So in addition to what Pat just talked about, right? I think we are all aware of the progression in technology in anything. So if you take telephones or airlines, right? Initially, they're available to a small number of people when you have to go to special places. Same way, if we took like some monitoring technologies, you had to be in a hospital, inpatient, right? Now that kind of monitoring is available at home, right? Just like how we all have access to, more of us have access to phone and all that, right? Then the next big thing, what Pat and Anil touched on, medicine is meant to be very personalized, right? You go to your doctor to get a care for yourself, but public health is meant to be, from preventive perspective, is meant to be very broad oriented, right? So how can we get that scale and yet be personalized, right? That that is enabled by modern day technologies like cloud computing and machine learning, right? So what we can do is we can offer a service at scale, so we don't have to just standardize and push one piece of content. Or if you take a simple example, in India, I might have to consume that same content in multiple languages, and it's a enormous effort, and therefore you might find a lot of education only available in English, right? But if you want to really get it into the hands of the common man, then you want to, you need to be able to translate it into multiple languages. That has become very easy now, right? So that's a big shift. And then from a behavior perspective, it is very important to make, when technology should really be an aid, right? It's so if I want to do something, it needs to be easy and useful to me. Otherwise, it just unnecessarily complicate things. So with the advent of wearables, right? So there are lots of wearables. Not, I mean, we know of watches, but for different types of things, from seizure detections to BP and heart rate monitors, all of those, right? There are different variations of things that are being innovated every day. I mean, and there's talks about embedding some of these into our daily wear, right? I mean, as in clothing, so that it can keep even greater tracing and tracking of our things, so that you're not going to the doctor once a year for a preventative health checkup, right? We monitor our machines every day, right? Same way, I think we ought to be able to monitor our bodies every day and then act on it when it is needed, right? It's still a ways to go, but we can clearly see that progression happening, and it's very practical. And it's just not a matter of if, but it's a matter of when it's going to happen, right? So I think those are all things that are very attractive, and COVID is pushing these things even further because it's forcing remote care. That's forcing more innovation. So all these factors, cloud computing, machine learning, COVID forcing, more digitization across all industries. I think this is a perfect time to see these changes, be adopted.
That's a fascinating overview. I definitely feel that there is a lot happening, especially with this access part of the technology to people, how easily it is available to, people who we could not have thought about maybe even 5 years back. And now everybody has a wearable, everybody has a tracker to do things. As Ani was saying, everybody is using to get six packs. So, so that's quite fascinating. I just wanted to bring a point back to Pat, and I remember from a past discussion, Pat, you mentioning about the continuum of the preventative. Can you like to talk about that a little bit?
Yeah, there's different forms of prevention. So if you think of a continuum, so starting with what's called now primordial prevention, which is, so a lot of times when we think of prevention, we think of like managing a risk factor, like I'm going to prevent a heart attack. And so I'm going to do that by controlling my blood pressure. So what primordial prevention starts early in life, and it's really designed to eliminate those risk factors to begin with. So your high cholesterol, your high blood pressure, your high glucose or diabetes, also the behaviors related to that. So really early in life, forming those good habits, eating well, getting plenty of physical activity, trying to manage the stress, not necessarily eliminate stress, but manage it well. So that's called primordial. The next level up is primary prevention. So that's where we think of, okay, so again, if my goal is to prevent a heart attack or a stroke, then I do that by preventing risk factors like tobacco, high blood pressure, high cholesterol. So primary prevention is managing those risk factors. Secondary prevention is done after those risk factors occur. So now it's about treating those risk factors. So treating your blood pressure, treating your diabetes, treating your cholesterol. And then of course, some people still go on to have heart attacks and strokes, but you're trying to prevent the next one. And that's actually called tertiary prevention. So some examples going back down the line. So cardiac and stroke rehab would be examples of tertiary prevention, where you're actually managing that condition that already occurs. So you're not trying to prevent heart disease, you're trying to prevent that next heart attack from happening. Secondary prevention, maybe managing, you're being treated for your high cholesterol. Primary prevention, again, maybe using lifestyle factors. You're trying to modify your diet and get some more activity to lose a few pounds. And again, the primordial prevention is using more wide scoping preventive habits to manage your health.
I think that gives a very good understanding of the whole spectrum of course, the preventative care continuum. But also, this can then lead to better understanding of people who want to intervene at the right place, and then think about this value-based aspect, the outcomes-based approach, because at each of these care perspectives, the patient's behaviors and the way to influence them is going to change, right? So I think that was a very useful concept to understand. And so now that we have kind of cleared our thoughts around the basics of preventative medicine and the role of technology, I would really love to get perspectives from each of you about your work and how that is influencing this area through your perspectives. And maybe we can begin with uh, with Pat about the work that is being done by American Heart Association, um, and the kind of things that you get involved in. Would love to understand that perspective. Pat.
Sure. So the American Heart Association is not a technology company. We're really a science-based company. Part of our mission is really to be a relentless force for a world of longer and healthier lives. If you notice, that didn't include the word American, and it didn't include the word heart. And so we really want to be that relentless force. Our role in our Center for Health Technology is to be a bridge between the technology world and the clinical and scientific world. So that's why we work with technologists such as Sri and Anil. And it's really to help to, first of all, convene, get all of the stakeholders together. So not just the tech and not just the doctors, but other parts of that, including the patients and the policymakers, the people that finance and pay the bills. Try to get all of those groups on the same page. So that's a convening part of it. It's also beginning to disseminate information in a way that people can understand, that is coming from a trusted source, and that is designed to achieve overall health impact. So someone mentioned earlier about some of all of the information out on the internet. So how does one know what's good and what's not? So having a trusted source like the American Heart Association, and then finally helping the technology world with achieving outcomes and being able to do research and measure those things, just like we do studies on the efficacy of a drug or a test or other parts of the healthcare system. It's very challenging with technology, because technology is advancing so rapidly. It's almost impossible to tell that technologist to stop innovating for the next several years while we study this, because if you do that, you've lost time in innovation. So really helping to achieve the highest level of evidence possible while still maintaining that innovation edge.
I think that's a fantastic perspective. Being a clinical researcher myself, I can understand the tug of war between speed and the high value of evidence that we all think
Yeah,
about.
if you compare it to, for example, a pharmaceutical study, you can control for the drug, and you can do this, and you can have a placebo. It's very, I wouldn't say impossible, but it's very difficult to do that same type of study with technology. It's really hard to have a placebo technology, for example. And it's also really hard to control for that technology, because people like Sri Anil want to continue making their products better. And so they're not satisfied with saying, well, what I did last year is good enough to study. They want to continue pushing that envelope, which is good. So we have to figure out ways to accommodate for both of those.
That's fantastic. And you talk about also the trust built with patient communities and the kind of sources they use for information.
Can you repeat that? I think you broke up a little bit.
And I can't help but talk about right kind of information to people. Sorry, can you hear me?
I think he was talking about the trust factor, how important that is, Pat, in terms of,
Yeah, and so really speaking about Life Simple 7, and how that was built to get the right information to patients.
Yeah, Life Simple 7 was developed over 10 years ago. The lead scientist on that is Dr. Don Lloyd Jones from Northwestern. He's actually now the current president of the American Heart Association. But back in 2010, we had our goal was to improve cardiovascular health, not just prevent heart attacks and strokes. And when we did that, we had to actually define what cardiovascular health even meant. And so that became the origin of Life Simple 7. These are 7 factors that are well documented and related directly to cardiovascular health. So there's 3 that are in the behavior category, so physical activity, nutrition, and tobacco cessation. And then 4 that are basically biometrics, so weight, blood pressure, cholesterol, and glucose, which can lead to diabetes. Now, you may be sitting here thinking, well, there's some missing elements, aren't there? Probably the biggest, I wouldn't say missing element, but the thing that we have to address also is the mental health of the individual. And not just do they have depression or anxiety, but their level of engagement and motivation, their ability to adopt behavior change. So all of that, so that mental health actually is embedded into all 7 of those other categories. And then of course, the other thing, because we are preventing conditions, we also have to add medication adherence to that as well, to help sustain that really important behavior change of taking your medicine as prescribed.
That's definitely a great tool to have, and we talk about that a little bit later on. But I want to go to Anil now, really also understand, how Anil is shaping this up at IntelliEdge, some of the great case studies that you have come across. Would really like to get those perspectives.
Sure. So as you know, Santosh, we are in the business of, variables and home monitoring. So our company basically is trying to bring the latest technology so that the patients are much closer to their care providers. And that happens through these variables where the data is available to a given care providing team on a regular basis, whether you're monitoring hypertension, whether you're monitoring change in weight for the congestive heart failure patients, whether you are monitoring the glucose variations that are beyond the normal ranges. So this, I will pick up on what Sri said. The whole point that we are focused on is on scale and precision. It's a huge concept. In other words, if I can actually monitor blood pressure of 1,000 patients using the dashboard that we have, at the same time, I'm able to see what kind of medication is most optimal for a given patient at what dosage and what combination of medicine. I have basically, because I'm getting the data on daily basis. In fact, we are doing a study right now, or a program with one of the large academic health centers on the West Coast, where the trial is looking at the CHF patient, congestive heart failure patients. But because of certain kinds of medication these patients are given, they monitor the blood pressure of these patients. So these patients using IntelliEdge system are basically recording their blood pressure twice a day. And each time what they do is they take 2 readings of blood pressure, because blood pressure kind of varies from time to time and the way you take your readings and stuff. And that information keeps coming on a regular basis to the providers, to the physicians, to the cardiologists. Now they are able to see for a particular patient. So this becomes a much more individualized operation in terms of what why this patient is seeing these kind of side effects or not seeing the improvement. So you can plot the medication that they are taking and the blood pressure trend that they are seeing. So you can customize and you can optimize a particular patient's medication and its dosage levels. So that's the level of operations we want to create, not in 1-by-1 setting, but 1 to 100 patient setting, where a mid-level professional is able to manage on a dashboard what is happening with a given patient that she's monitoring 100 or 150 at a time. So that we are pretty excited about those kind of innovations that we are bringing, to the marketplace. One other example I will give you in terms of the innovation. We have a customer in the hospice environment, right? So what we have done, we have collaborated with a robot company. It's called the Tammy Robots. So on the head of the Tammy Robots is basically a tablet on which our software runs. So this robot goes from room to room in patient's home, take the readings, and the physicians can actually have a telehealth call with the patient if they see some unusual readings coming from that particular patient. So you actually have a rounding done by your robot with the technology that we have created. So it brings efficiency and it monitors these patients on a daily basis at a lower cost. So those are some of the innovations and the kind of changes that I think the technology can bring in the marketplace.
Fascinating. Some of it sounds like sci-fi to from where we used to be, but it definitely is becoming more a reality as we were talking about. How is the acceptance from patients about some of these technologies? Are they, how are they approaching this? What do they think about this?
Yeah, so when we started the program, one of our earliest patient was 92 years old. She was, and her son basically said that I think she has signed up for your program, but it is not for her. The mother immediately said, no, I can actually do it. And she was one of the more consistent patient to send her data to her physician. And it was not just the sending the data. I think she found a social connection. She was able to connect with nurse, with a patient through this medium. And otherwise she's sitting at home alone, right? Now she actually is engaging. So one of these side benefits of this remote patient monitoring and home monitoring is the social engagement, the patient engagement that is actually happening. And that is actually good for the providers as well as for the patients.
I think that's a fascinating point. A lot of people think that technology is kind of going to take away the personal touch, but it can also be used in this way where we can increase the personal touch, the interaction with the patients. And that's a fascinating point. I really feel inspired about it, the way you explain. Sri, I'm going to come to you and also get perspectives about our work at Rain Foundation and also some of the cases that we have seen from our perspective.
Yeah, so I think so what Pat mentioned and what American Heart Association is doing, I mean, it's amazing. They spend millions of dollars, right? Tens, hundreds of millions of dollars on research. And that research is done by Stanford Health, Johns Hopkins, really who is who in the healthcare industry, right? And what Anil touched about is how can we take that research and apply it in a more acute care setting, like when somebody is in need of care and continue. But when you look at what we talked about in the past, how do we make such a thing available to a low resource setting where people may not be able to pay, right? That's where we fill the gap, right? So when we're not going to be able to offer what IntelliH offers, right? So to give you an example, when you're talking about like the example that Anil gave, how do I monitor glucose levels, right? We're not going to go to that level, right? What we're going to say is, at least let us get to a point where I may not know exact, quality of calories that are going into my body, but can I at least start a discipline where I know overall I'm consuming 2,000 calories, burning only 1,000 calories. So it gives an indication, right? So we are focused on very low fidelity, free service in a public health wellness setting, right? Um, and all of us, as we will try to move up the spectrum, and Anil and they will try to make their service more accessible. Right today, their service may not be affordable in India, but I'm pretty sure in a few years to come, it will be very affordable in India. I mean, I'm sure there are some people now that can afford this service, but I'm talking about for them to make business sense. But some of the customer base, when we're talking about rural India or Africa, it might take a while for them to be able to afford such a service. But what can we do for them, applying some of those life simple 7 principles, right? So we are particularly focusing on those principles. We benefit a lot from the American Heart Association research and the guidance that Pat gives us in terms of all of these activities, like medication management, vital management, symptom management, nutrition management, physical activity management, and mental stress management, right? These 6 pillars, we want to try to find free, low fidelity, easily accessible solutions. That's our role.
And so you definitely talk about this also in our discussions, especially with regards to the access and how to improve this through technology that is open sourced. And can you also give a little bit of perspective about that?
Yeah, thanks. Yeah, that's another aspect. So to give some examples, like what are we trying to do, right? So medication adherence is a challenge, and what we're trying to design a water bottle with a pill compartment so that somebody will just consume a medicine and drink water, and we will keep track of whether they're taking their medications. When they go to their doctors, understand, they're able to show a report. And then we keep track of hydration adherence, right? Similarly, anemia is a very big problem, especially for women going into maternity, right? And how can we, like, if you remember early days, our doctors would just look at our conjunctiva and detect maybe you're anemic or not. So how can we build a machine learning model like that to figure out, that they may or may not have anemia? So it's just prompting them, nudging them to go get their test done, right? So make it very freely accessible, right? Our goal is to build all these machine learning models and access, so someone can just post that picture of their conjunctiva on WhatsApp and it'll tell them whether they're anemic or not, right? So how we make this accessible on WhatsApp in their own local vernacular language, and that machine learning model. Our goal is to build such things and open source it, so it is freely available for anybody in the world.
Those are all fascinating insights from all three of you. And Sri, as you summarized very well for me, how these different pieces are moving: the research and development, the early pieces of understanding where to intervene, how to intervene, then thinking about where it is, and then going to so. Sorry, I think that was fascinating. Sorry about that. I'm going to now move on to another topic. I'm just going to remind everyone to post their questions in the chat box. But really, what is the role of behaviors? So, Pat, can we talk about that a little bit?
Yeah, so like I mentioned at the start, I mean, the whole premise of prevention is to promote positive behaviors and to manage or eliminate negative behaviors. So how do we do that? So there is also kind of a process there, and it begins with knowledge and education. Okay, so it's part of what we call our health literacy model. So the first level is, and I'll use a blood pressure as an example. So the knowledge, so I understand why blood pressure is important and that I need to take my blood pressure every day, for example. Okay. The next level then is numeracy, which is applying the number to that. So, okay, I understand why blood pressure is important, but do I understand the numbers? And so I can read a blood pressure and know that what range it's in, or know what to do with that information. That really leads to the third level, which is navigation. So what do I do with this information? So if my blood pressure is sky high, let's say it's even in a hypertensive crisis zone, do I know what to do? So if let's say it's 200 over 120. So should I call my doctor? Should I dial 911? Should I relax and hope it goes away? So understanding that information, in the case of blood pressure, you would actually wait 5 minutes, retest, and if it's still that elevated, you would dial 911. The next level is communication. So do I know what information to share with my doctor and what questions to ask? A lot of times, I hear physicians say, oh, if I had only known, if you had only shared that information with me that you were having chest pain, even at rest, I would have been able to do something about it. And then the final level is decision making. So what do I do with, again, do I, in the case of blood pressure, do I go on a low sodium diet? Do I start taking blood pressure medications? So some of those decisions are unilateral. I can make that decision myself. Some of those decisions are called shared decision-making with your healthcare professional. So why did I go through this whole process? Well, you need that whole process. Not any one of those individual factors by themselves is enough to support behavior change. But if you work through that whole continuum from I know why this is important to now I know what to do about it, that's how you, in our minds, are able to change behavior and sustain that change.
Sri and Anil, would you like to also talk about your perspectives of behaviors and habits? I think Pat very well explained this aspect about how the patient should understand this. Any other perspectives that you would like to bring?
Well, I will have a slightly different view on this. I would guess, and there are studies about this also, 80 to 90% of the population know that doing physical activity, physical exercise is good for them. Almost the same percent, I would guess, know that eating more fruits and vegetables is good for them. Yet, they do not actually act upon it, right? So that also is a fact, and it's a behavioral issue. Nothing to do with information, nothing to do in terms of what is the known science behind it. It's just the personal behavior that is a roadblock to this. There was a study in Australia, I believe, that sort of like followed or asked or surveyed 6,000 obese people, and they said that, what is the impediment? Why do you not go for physical exercise or physical activity? And they cited three main reasons. One was that, they're not motivated enough. They're not disciplined enough. So that's a behavioral issue directly. Second, they were saying it's a discomfort, pain. I'm going to run on the treadmill or do some resistance weight training, right? There's a pain component to that. That's behavioral aspect of it. And the third most common reason cited in multiple such studies is this lack of time, right? Mm-hmm. And I think when presidents and the other people can find time to do the exercise, I'm sure all of us can actually find 30 minutes. That's what CDC suggests a day to do some physical activity. So I think that there is some fundamental behavioral component to this. And this has to do, I think there are other studies that talk about, if there was a short-term reward, then I think people will more likely to do it. But people do not tend to have the dilemma of 1 cookie now versus 2 cookies later. Very few people have that mindset of 2 cookies later, right? So I want to sort of not go to the gym, sit on the sofa and entertain myself with a new movie or a show is much easier. It's a reward is right there. It satisfies your desires and satisfies your entertainment quotient. But you're going to see your sort of improvement in glucose levels or lower blood pressure after 3 months if you continuously do so. So I think we got to really think about how do you tackle those kind of issues at scale.
If I can jump back in for a moment, I completely agree with Anil, and actually forgot about the final part of our model, which is you have to address the mental health aspect first, which is a lot of those barriers. Once you've addressed the mental health, you have to have a behavioral approach, something that is motivating. And once you've done that, then you can start providing more information and education. So I completely agree with what Anil's saying.
Yeah, Santosh, I mean, just for all the audience, I think I would highly recommend reading or listening to a book called Atomic Habits. So what we're talking about here is how can we make something a habit in our life, right? So that it doesn't feel like pain, it doesn't feel like discomfort, like Anil is talking about. What we are trying to do, and I think we all will agree that if we magically eliminated all other barriers, so no cost barrier, no accessibility barrier, no education barrier, everybody has access to all ample medications, monitoring tools. End of the day, it's going to be this ourself, our behavior that is inhibiting us, right? So I don't think anybody will argue about that. So what we are trying to do is how can we, can we do some things that doesn't even bother anybody's mind? So for example, if I have a heart failure patient, I'm required to be taking my weight every day because I'm trying to detect fluid accumulation in my body to prevent hospitalization. Okay. I know that we are very addicted to looking at televisions or smart screens, right? Can that smart screen look at our face and tell us that there is fluid accumulation in our body? So they're going about doing their stuff. They're not bothered to look, take their weight. So can we build solutions like that that does not make behavior an issue? Is where we are focusing on, right? That's an ultimate thing that I just said. We may not reach an ultimate state, but there are intermediate states. Today, if somebody is very disciplined, it's very painful for them. If they get on a weight scale, they have to maintain a spreadsheet of their weight and trends. But can they just step on a scale or a BP cuff, which will automatically take their weight and graph it for them and tell them, hey, you need to pay more attention. It's increasing, decreasing. So Anil, telehealth already has solutions like this, right? So we are trying to look at how can we make some of those solutions even more accessible in a low resource setting, right? That's why I think behavior is the most important thing, and all of us are really trying to tackle that part of it.
I think all three of you touched upon. So sorry, Anil.
I was just going to say, so Shri, I think you are absolutely right. I think the less effort on the patient side, the more compliance it will have, right? So there are technologies now. We are working with a company that actually trying to get the blood glucose levels and the blood pressure through a smartwatch, which is not available today. There are multiple companies who are trying. None of them actually are FDA approved except for Omron. And I actually purchased this Omron watch. It's a $500 watch, a few weeks ago, but it is so bulky. And I compared that with the traditional cuff, it is not that accurate. Although it is FDA approved, that's the only one in the world, I believe, which is FDA approved smartwatch to monitor your blood pressure. So technology is actually getting there. It's just not there yet. But I think your vision, even then, you do not have to wear the watch. You get in front of your mirror, right? And I think there is a camera there in the morning. That's where I think it can detect whether there is kind of a loss of fluid or accumulation of fluid. That will be fantastic. And I think there are some things that people are talking about in terms of the floors having able to measure your weight. So I think there are certain newer technologies out there that can do some of the vision that you have.
Yeah, cool.
I think in the last couple of minutes, we have gone from being a cookie monster, thinking about cookies later, to mirror on the wall. Tell us how obese we are, kind of a thought process. But this is fascinating and really cool perspectives about what is possible, not only from just making this technology, but also having access to the technology to the right people, motivating them, and also thinking about what motivates them, what doesn't motivate them, so on and so forth. Really a great discussion. We are at the end of our discussion, but before we jump into a couple of questions that have come on my way, I really wanted all of you to be put into sort of the talk, walk the talk kind of a thought process, and ask what are you, if at all, to use technology for your help yourself, preventing some stuff, unfortunate stuff that might happen down the road. So anyone who wants to share?
I can go, and one of the things that I guess it's just all of us, when we try to put our mind to it, we learn something, right? I call this like the 2-2-2 rule, right? If you can practice 2 minutes of mindfulness, I'm not saying meditation, mindfulness, I'm just saying for 2 minutes, focus your mind on your breath, right? And then 2 miles of whatever you do, walk, run, elliptical, whatever, right? And 2 meals a day, right? Eventually you want to get 1 meal a day, but 2 meals a day within when there is daylight. I think, and I'm not saying that I'm anywhere close to this, but for whatever I have tried to achieve, I see a tremendous difference in just following these 3 things, right? And it's very interesting how this behavior. So now that you get to that state, you'll see the reward. If you stick to it for a couple of weeks, you'll see the reward, and then it starts motivating you to do more. Right? So, for example, that 2 miles now, I actually want to build some muscle and not just do cardio. So I didn't think that I would get motivated to do something like that. I never thought that I would, spend a day or two on lifting, but that started happening. So I think we just start very simple. And the most important thing is that 2 minutes of mindfulness. I mean, that is the key trigger for everything.
That's an awesome one.
Yeah.
So Sri brings up a really good point that a lot of these approaches can be relatively low tech or even non-tech approaches that really revolve around your behaviors. From a technology perspective, a couple of things I do. I track my physical activity with a watch. I also monitor my blood pressure, and it's with a validated device that has a Bluetooth connection to a cloud, so I can actually record. I don't have to write it down on a little note card and then get it lost in the laundry. So those are probably the 2 most important things, but those don't actually do anything without it engaging in my behavior. So hopefully those help me stay on my exercise routine and monitor my diet. And probably the most important thing is also managing my stress.
Awesome. Thanks for sharing.
So Santosh, my more on the round of diet and exercise. So I do this not 2 times 2 meals a day, but I do 14-10 intermittent fasting. So I'm not eating after 7 p.m. until next day, 9 a.m. So that I think has become a routine for me in the last 3 to 4 weeks. So I think that is good. Atomic habits, I think, is a wonderful concept. You start very small and just do one thing. And I think there was a professor at Harvard who was kind of, who wrote the book, Dr. Clayton wrote the book, Investor's Dilemma. His principle was, and I try to follow that principle, don't break your promise even once.
Yes.
Don't break your promise even once. Even if you do not go and do exercise at the gym, get on your shoes, get outside, walk for 5 minutes, come back.
Yeah.
It's okay. But don't break your promise even once. So that principle actually is helping me. And like Pat, I also do 3 things in the morning as I get up. I get on the scale, and I have IntelliEdge, it basically records everything. And then I do take my blood pressure. So that gets recorded. And those are the 2 things. But from behavioral perspective, I just follow one principle. Don't break your promise even once.
Yeah, I think that's a fascinating point, and I think atomic habits also talks about that. A lot of people have converted that into saying called no zero day. So you have to do something. If you can't walk 2 miles, then can you just go and take a walk for 10 minutes? Because that's doable. So
Or even just say step out of the door and come back in. Don't even go for a
yes.
Yeah.
Awesome. I think this was a fantastic discussion. We are at the end of the call, and there are a couple of questions, but I would just like to take one of them. The variables and the trackers are, of course, changing the way we are looking at some of the measurements and collecting the data that can be useful for patients themselves. Wouldn't that add a strain to patients themselves, but also to the doctors who need to deal with this, to the healthcare systems, which might be already straining with patient numbers? This is an additional thought to them. Any thoughts on that? So strain on patients, strain on because they are looking at this all the time. Does that kind of bother them? Any experience on that side? And also, how should healthcare systems deal?
Yeah, I will respond to this. I think there is a virtual cycle or there is a vicious cycle. If you start to improve, I think you will be taking more and more readings and feel good about it, right? And you will continue to improve upon that because you got success, and success will spiral up. But if you're not making much progress, and it is actually not making a difference in your blood pressure or glucose level or your something or weight, you might get anxious about it. But in either direction, if you seek help at the right place with the doctors, I think eventually it will help you. See, if you can measure something, you can improve it, right? That's an old saying. If you do not have any idea, you only find out what the problem is when you go to the doctor next time after 3 months or 6 months. The situation actually, it's like putting your head in the sand. You will realize from the doctor that your blood pressure is 170 over 90. That's not good. Early through these variables yourself, try to do something with it, and then certainly seek the help of your physician and other people to see how you can actually manage it.
And I'll just add briefly, it has to be relevant, both for the patient and for the healthcare professional. If it's just, information without any context or without an action point, then people will get tired of it. So they need to know what to do with the information.
Both very important perspectives. I think we have lots of other thoughts to discuss. There are so many other perspectives that got left out to the discussion, but I hope that it was quite useful to all our attendees. I really thank everyone to join today for this webinar. Thanks a lot, Pat and Sri, for also your thoughts, sharing your thoughts, and this great discussion. We'll surely meet again and continue this in a future webinar. Thank you, everyone, and talk to you soon. Bye-bye.
Okay, thank you.
Thank you.
Yeah, bye-bye. Thanks. Yeah, bye.